Welcome to the module Health Insurance and Transition. This is the fourth of 10 modules in this course. Eligibility and application requirements change frequently. Always direct students and caregivers to insurers for updated information. By the end of this module, you will be able to describe common options for health insurance coverage for transition-age students, refer students and families to insurance resources, and add insurance-related activities to transition plans. Addressing insurance during transition is critical for the student's health. Prior to the Affordable Care Act, transition included financially or medically catastrophic gaps in healthcare. Consider the immediate and long-term effects of losing prescription coverage for students with cystic fibrosis, diabetes, or muscular dystrophy. How many days or months without treatment are acceptable? Today, if students plan ahead, losing coverage is avoidable. This section describes Medicaid, highlighting differences between coverage for children and for adults. KidCare is the state of Florida's program for children. Florida Healthy Kids, Medicaid, and Children's Medical Services Plan are all part of KidCare. These related programs have specific eligibility requirements for their services. KidCare benefits include well child visits, shots, hospital stays, dental coverage, vision services, prescriptions, and mental health services. Additional benefits vary by program. Students age out of coverage at their 19th or 21st birthday, depending on which program provides their KidCare coverage. The student must then apply for new coverage, whether through Medicaid or through other insurers. Students moving from Children's to Adults Medicaid will find many differences between the two programs. For example, medical eligibility is higher for adults than for children. Conversely, students who did not meet financial eligibility for KidCare may qualify for Medicaid. Typically, adults are eligible for Medicaid if they are permanently disabled, ineligible for Medicare, and meet financial requirements. There are several specific programs under which adults may qualify for Medicaid beyond these parameters. The next few slides will examine some of these programs. Adults who are eligible for SSI are automatically eligible for Medicaid coverage. The Social Security Administration manages this coverage. The student need not file a separate Medicaid application unless they require Medicaid waiver services from the state, such as for home-based healthcare services. Students who age out of foster care under responsibility of the state of Florida and with Medicaid may continue their coverage until age 26. There is no income limit or medical requirements for this coverage. Home and Community-Based Services, or HCBS waivers, are Medicaid programs that provide services in the home for persons who would otherwise require care in a hospital or nursing facility. Without waiver services delivered in the community, some young adults will not be able to live at home or receive needed supports in the workplace. Waivers provide specific services over and above those in the general Medicaid adult benefits package and are targeted to persons who demonstrate the need for a high level of care. Enrollment is typically capped. Once enrollment reaches a specified number or dollar threshold, waiting lists are created. The Agency for Persons with Disabilities waiver provides home and community-based services for people with specific intellectual or developmental disabilities. Each individual who is determined eligible for services is assigned a support coordinator. Once on the waiver, their support coordinator meets with the student regularly to assess, develop, and monitor an individualized support plan. The support plan, much like a transition plan, includes goals for services, health, and safety. Much like the other waivers, it is extremely important to apply despite the wait list. Those on the wait list receive limited services until they enter the waiver program. If a student begins receiving services in childhood, include their APD support coordinator for creating and implementing the healthcare transition plan. Young adults have multiple options to maintain coverage through their parents' insurance. Adult children can remain on or later rejoin a parent's plan until age 26, even if they are otherwise independent. This rule applies to parents' employment benefits and to individual plans, such as those purchased on healthcare.gov. 44 states, including Florida, have laws that mandate insurers continue coverage of children with disabilities after age 26. To qualify for continuation of coverage, a physician must certify that the student is incapable of self-sustaining employment due to intellectual or physical disability. The student must be chiefly dependent on the policyholder for support and maintenance. Examples of students who may be eligible include those who receive Social Security benefits, those who require total supervisory physical assistance or custodial care, or students for whom treatment, rehabilitation, educational training, or occupational accommodation has not and will not result in an ability to support themselves. The marketplace plans are those created through the Affordable Care Act. A marketplace is a site to purchase individual coverage. Students can sign up for health insurance during open enrollment periods, at the end of the year, or upon major life changes such as marriage or a change in income. The state of Florida elected not to create a state-based marketplace. Therefore, healthcare.gov is the only source of marketplace plans for Floridians. The next few slides describe additional options to obtain healthcare coverage. If available, students may elect to use their own employment-based insurance prior to age 26. That is, they are not required to remain on their parents' insurance if they are working and their employer offers benefits. In the event that the student loses access to their own employment-based coverage or to their parents, they may elect to extend those benefits by purchasing COBRA continuation of health insurance. Students with chronic conditions may be eligible for other public insurance programs, including Medicare. Even if a student does not qualify for Medicaid, they may qualify for other state programs, such as medically needy coverage or discount drug programs. Insurance is a dense and potentially overwhelming topic. This section identifies ways to include insurance in transition plans. Students and parents have varying levels of familiarity with health insurance rules and requirements. Educate students about the importance of maintaining coverage and guide them to reliable resources. Inform students with disabilities of key provisions within the Affordable Care Act that protect their coverage. Just the Facts, the 411 on health insurance for young adults ages 18 to 30 in Florida, helps students navigate health insurance. It has sections for different insurance needs, such as private health insurance, public health insurance, and no health insurance. Provide the guide to students as a transition plan activity. Healthcare.gov provides a website for students to find local assistance with signing up for health insurance. The site is searchable by state or by zip code. Add contact navigators to the transition plan to coincide with the year that the student ages out of pediatric coverage. Consider age-appropriate steps for health insurance at each stage of transition. Examples of such activities include carrying their own insurance card, reading an explanation of benefits summary, reviewing the current health insurance plan, locating key information about new coverage, and identifying important dates. Encourage parents to contact their employer or insurance company to maintain their child's private coverage. Students can complete the Adult Medicaid application online or by mailing in a paper application. Use transition assessment and planning tools to include filing a Medicaid application at age 19 or 21. The waiting lists for Florida Medicaid waivers can be quite long, sometimes years. Do not discourage the student from applying because of the waiting lists. This is the only way to access waiver programs. To apply for a waiver, the student should contact the operating agency and/or submit a Medicaid application. This is an extremely important transition plan activity for students who will require in-home care, nursing home care, or workplace supports. Remember, you have important resources to help you include health insurance coverage in the student's IHPs, 504 plans, and IEPs. If the student has CMS plan or APD services, include their nurse coordinator in your activities. Healthcare providers, including the office's care coordinator, are an excellent resource to help students learn how to use health insurance. List 3 places you will refer students and caregivers to when they have insurance questions. These might include a specific person in your school or their healthcare provider's hospital system, a specific program, or a website. This slide will automatically advance in 1 minute, giving you time to jot down your answers to the questions on this screen. Before closing this module, let's look at tools to support these strategies in your school. Within the Medicaid website, this page provides contact information for local and regional offices. This site provides the newest and most relevant articles on the Affordable Care Act for young adults. The Florida Division of Consumer Services has a website dedicated to state protections and programs for purchasing health insurance. The Exceptional Parent website offers a succinct summary of how the Affordable Care Act affects students with developmental and intellectual disabilities. These are additional resources for obtaining public coverage. Transitioning youth have more options than ever for maintaining coverage. Finding out specific information for their individualized coverage needs is a dense but important topic. Encourage students and families to be persistent with insurers. Follow the links to the tools discussed in this module. You can pause the presentation for a quick break or continue on directly to the next module.